Welcome back. People have a lot of questions about coronavirus, how it spreads, and what the risk is here in the U.S.
Yeah, so we've asked New Hampshire State epidemiologist Dr. Benjamin Chan to join us to help answer some of those questions sent in by WMUR viewers today on our Facebook page. Thank you so much for joining us today.
My pleasure, thank you.
Well, first off, Dr. Chan, this is a new virus, so how can you be prepared to respond to something that didn't really exist just a few months ago?
Yeah, that's a great question. You know, this is a new epidemic of a new coronavirus. We first became aware of this virus a couple of months ago, and over that time I've seen it spread to multiple other countries outside of China. I will say, though, that with any new virus presents its own challenges, but we have experience, and this is part of the core public health work that we do to responding to new and emerging infectious disease threats like this new coronavirus. We have experience responding to SARS coronavirus in the past, MERS, the H1N1 pandemic, and so we have a dedicated group of professionals who are working very actively with partners around the state and healthcare providers to try and address the concerns and the situation we're seeing globally.
Let's get to our viewer Facebook questions. Doreen Travis asks, can you get it from food or other things? I thought I read somewhere the virus came from people eating meat from an infected animal.
So that's a great question. The general question is about how do you get the virus? And the primary way that people are going to acquire this infection is by close contact. That's 6 feet or less close contact with someone who is infected with the virus and coughing. So it's spread through respiratory droplets primarily. For that reason, you know, there are precautions being taken in countries where this is widespread to try and prevent close contact, to prevent, you know, respiratory transmission of this virus.
And Brian Lurvey asks, people that have come down with a virus, will the body fight it off like it does the flu?
Yeah, again, this is a new virus, so we're still learning about how easily it's transmitted and how long it takes someone's body to clear the infection. But generally speaking, as with many other types of infections and viruses, a person's immune system and their own body will be able to fight off the virus. How long that takes is still under investigation.
Jeff Seitz writes in asking about the survival rate, saying he's heard that it may not be as bad as the media is portraying. So is coverage of the coronavirus being overblown, in your opinion?
So we take emergence of any new virus or any new infectious disease threat very seriously. We've seen this virus spread very easily from China to other countries. We now have instances of community-wide spread in other countries outside of China. So we know that this is a virus that can spread very easily. And so we're still learning about it, but it's understandably and appropriately, I think, causing concern amongst residents of New Hampshire and people in our community because it's new, because we're still learning about it, because we've seen it spread very easily. But I think the question is a good point, that it's based on our experience with other viruses like SARS coronavirus back in 2002 and MERS coronavirus in 2012. It doesn't appear to be causing as many deaths as some of these other emerging infectious disease threats that we've seen. But it does appear to be able to cause severe disease. You know, people are ending up in the hospital. People are dying from this virus in other countries. There have been no deaths in the United States. But it does appear to potentially be more fatal, if you will, than the regular seasonal flu virus.
Okay.
You know, lastly, have you heard anything about any types of vaccines that might be on the horizon?
That's a great question. There are currently no vaccines to protect against this virus, and there's no medications to treat someone once they develop the disease. These are active areas of research, so there are vaccine candidates that are being developed, and some have already been developed. But once you have a candidate vaccine, it needs to go through a process of study to ensure that it's safe, to ensure that it's effective before it can be rolled out to the general population. And so it's probably going to be at least a year, more likely a year and a half or 2 years before we have an effective vaccine. And so for that reason, the way that we prevent and protect people's health, prevent spread of this virus and protect people's health, are the everyday strategies that we talk about every year with flu. People need to be paying attention to frequent hand washing, cleaning frequently touched surfaces, staying home if they're sick or feeling ill, especially if they have a fever or respiratory illness.
Dr. Chan, thank you for your time.
Thank you so much.
Thank
We
you.
will keep talking.